Valuable resource for women and people who are. The British Journal of Sports Medicine just released the 2025 Canadian Physical Activity Guidelines for women and people who are 1 year postpartum. There's a lot of great information here. I'm not going to be able to cover all of it, but I'm going to highlight some of the real key takeaways. First, we see the threshold, the goal activity to reach within that first year is 120 minutes of moderate to vigorous physical activity every week. Now, moderate intensity can be a brisk walk. It can be light resistance training with bands or even with really light weights. High intensity activity, vigorous, can be running and heavy resistance training. As I'll mention here shortly, those are safe things to do in most cases. First, it's starting with light activity, being as active as you can be, acknowledging that childbirth is an extremely physically and emotionally demanding activity. The goal is to try to get to moderate intensity activity within the first 12 weeks. And again, that can simply be brisk walking or starting to do some very light resistance training. One of the most beneficial areas of resistance or strength training you can do is pelvic floor muscle training. And that's really going to help to cut down the rates of or the risk of urinary incontinence or leakage. Now, when we talk about running and heavier resistance training, a big marker of when you can do those things is when sufficient healing has occurred. So you no longer have perineal tears, you don't have any of if you had a C-section, if that incision is fully healed, and then if you're trying those activities like running, resistance training, you're not having any vaginal bleeding. You do want to talk to your healthcare provider. There could be other contraindications to it, but in general, if you pass through those thresholds, it is going to be safe and very effective for you to start doing those moderate and vigorous intensity activities. Now, also acknowledging that having a baby completely disrupts your sleep schedule, their feeding, their care needs, and that can make some days really, really hard to go do activity. So again, doing walks, try to limit your sedentary time as much as you can. We see a lot of health benefits. It can help the limited time that you get to sleep. It can help with social and emotional well-being. So these are great guidelines. Again, these are just some of the high points, but the real key takeaway is to make sure that you're trying to be as active as you can, that the body responds better to activity than a ton of rest. That is going to be one of the best things you can do for yourself postpartum.